everybody. This is Azar again, Doctor of Physical Therapy. Today I want to talk about the shoulder instability and the problems that can happen that can cause shoulder instability and how we can treat it with physical therapy and how we can do home exercises to help that. Of course, these are very important situations. You have to see your orthopedist, get a real diagnosis with the MRI or X-ray, and then of course get a physical therapy advice also, and then if they want some stability exercises, then you're in the right track. This video can help you to do some stability exercises to help your shoulder to stabilize better. As we said, shoulder is one of the joints that is really unstable because of the movement, the variety of movement that it has, and the ball and socket joint, but is not like a hip ball and socket. Hip ball and socket is like this, but shoulder is like this. So of course it plays a lot more, and it has to play because we want a lot of motion. But at the same time we want stability, as we said. So I'm going to talk about some of the instability situations that can happen. So first of all is anterior dislocation. As you can see here, this guy has the anterior dislocation, so you can see the shoulder went forward and actually dislocated or subluxed forward. So it's kind of very specific, important situation here that can get treatment with the reduction. So they can go to emergency room and they can do that reduction maneuvers and put it back in place. So after they put it back in place, some of the ligaments or joint capsule can get injured during that maneuver. And even though it's on the back in the place, people may feel very unstable. Another instability situation would be acromioclavicular joint or AC joint. You can see the AC separation right here. We call it a step deformity. Look at this step here comparing to this side on this guy. Okay, so it means that this person has a separation on that ligament that brings the acromion process towards the collarbone in the front, which is very specific terms, but don't worry about them. The terms of instability, that's what you really need to know. Another one is a labrum tear. It's the same as meniscus tear in the knee or labrum tear in the hip. We have the cartilage in here, right in the middle of the joint, and this cartilage can get tear. So the shoulder can get very unstable and also can get very rubbed to each other and cause arthritis later. So all of this situation in short term can cause instability, and if they get chronic, we can get chronic instability of the shoulder. So we can the shoulder keeps popping back and forth, or you keep having that step deformity more or less during the days, depending on what activity you do. And you can have that labrum tear that makes the shoulder unstable. Actually, the labrum tear can cause, as we said, arthritis later and rubbing also, but at the same time it can cause instability. So all the shoulder instabilities, they have something in common. What we have to do, yes, we have to strengthen. This time is not much of the stretching needed, it's more of a strengthening needed. So for strengthening, we're gonna need either a ball or we can use a pillow. I'm gonna put it on the wall right here so you can see. And we have to have all the shoulders of the motion happening isometrically. As we said in the neck exercises, if you remember the neck isometric with the pillow or with the ball or with the elastic, we could do some stability exercises using the pillow on the wall or ball on the wall. We can do the same thing. So the first motion is opening motion, abduction, but we're not going to let it happen because we have a resistance of the ball. So we're going to press to the ball, 1, 2, 3, 4, 5, relax. Press the elbow to the wall, try to open it a little bit, but it doesn't really open, okay? That can cause a lot of pain with people that have rotator cuff tear or rotator cuff injury, as we already talked about. So, by the way, rotator cuff tear also can cause an instability if it gets chronic, but usually in the rotator cuff tear problems, we get surgery and repair. And it's not going to be a long-term instability, but if people choose not to do surgery and then they get tear forever, then definitely they need all the exercises to stabilize the shoulder. Another motion is going to be adduction. So that was abduction, going out. Now we're going to go in. So we're going to push in, 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. okay? Then we're gonna do all the rotations, okay? For the rotations, external rotation, going out, we're gonna push like this, 1, 2, 3, 4, 5, pushing out. So imagine this time, instead of opening from here, we're gonna have it close to our body, the elbow close to our body, and we're gonna press with the fist, right? 1, 2, 3, 4, 5, pressing with the fist. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. For internal rotation, we're gonna have to do it this way probably. So we're gonna go inwards, the elbow again, close to my body, and I'm gonna push my fist in. These are opposite motion, external rotation versus internal rotation, and opening versus closing, okay? Now, 2 more exercises, 1 to the front, 1 to the back, right? To the front, we're gonna push this forward while we have the elbow closed. We're gonna press the ball forward, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. You should feel the muscle work, okay? Muscle contraction without that much of a movement. Extension, we're gonna press back down, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So we pretty much covered all directions. Internal rotation, external rotation, abduction, adduction, and flexion and extension. So all the motions are covered. So we can do the same thing with the pillow, of course. So I'm gonna grab a pillow and I'm gonna show you the same thing can happen with the pillow. Abduction, adduction, external rotation, internal rotation, flexion or punching, and extension or backwards. So all are covered, all the strengthening exercises and stability exercises. I can show you a couple more of the stability exercises with the band. I'm gonna use this band right here, and I'm gonna show you the exercise with the band. So they're basically the same thing. We're gonna try to open, but we don't go anywhere. Right? Okay. But these are the band ones. It's gonna be a little bit more painful. So people that have so much pain, they better start with the pillow exercises and then gradually go forward with the pillow, and then we can do the band exercises later. So a lot of times the band exercises are saved for the future. I'm gonna do a session about the TheraBand exercises and strengthening advanced exercises later, and you can follow me over there. These are for the instability of the shoulder. Usually in the when they are acute, we want to do the isometric because it's very painful, and is the possibility that we can tear it more if we're going to do a lot of big movement with the weight. And if they get chronic and they're chronic enough and they are pain free, and then we're going to do a lot of band exercises. But remember, always cracking of a joint. If you have cracking with the feeling of instability, you probably have some kind of injuries either from before that caused the instability, or maybe genetically you are a hypermobile or unstable person, so you benefit from these isometric exercises anyways. Thank you so much for watching. Have a great day.